Hi everyone, this is Neil Writers here, consultant audiologist and director of ClearWax. Thank you for joining me in my latest video using the WAXscope. And here we have a patient who attended with bilateral, fully occluding earwax, and I'm showing you their right ear first. However, I actually performed the procedure in the left ear initially when they attended. That was the more problematic ear. And just to give you a case history, so this patient had been suffering from their ears for a few weeks, and they initially went elsewhere. And they really struggled in their left ear. So that's the ear that the other specialist attempted to do first, because that was the one that the patient was complaining of. And unfortunately, they weren't able to remove it. And so this patient was referred to myself. The left side in particular was really impacted. And in both ears, the entrance of the ear canal, so their first bend, so I'll just explain the ear anatomy, more specifically the outer ear. From the entrance of the ear canal to the eardrum, it's approximately about 2.6 centimeters. Now, there's variations. So obviously, adult ear canals are longer than children, and also males are longer than females. And there can be individual differences between males and females and children, of course, and also there can be differences between ears. So our right and left ear can be slightly different, but that's an average. Now, the outer third, so the first, let's say 8 millimeters, is composed of cartilage, and about half a centimeter into the ear canal, you have what we call the first bend. You can just see it to the left there, where the hairs are protruding from, and then about another 5 millimeters, you've got the second bend, which is just to the right of the specular. So there's a bit of a chicane, if you like, at the entrance of the ear canal, and then the ear canal narrows where we are now. So we're just removing this off the eardrum. So the way those hairs are to the left, that's the first bend. And this patient's first bend was, I wouldn't say it's collapsed to the point where it was closing the ear canal, but it was kind of caving in, and it was quite dense cartilage. So it wasn't as flexible as normal. So to open up the ear, you can see how I'm just sidestepping from right to left, and I'm pushing open the first bend with using the left hand side of the specular. And so the right side was pretty straightforward, so it was fully occluding, and it was also on the eardrum, so we removed that. Just going to mop up slightly. There's a few pieces of wax that because of that first bend, when I came out with the specular, that first bend was closing in, and it was preventing the whole wax blood coming out in one piece. It was breaking up, so we're just mopping that up. But I can see the eardrum just in the distance, but we'll have a good look at that in a moment. The left side, there was wax literally on the drum. It was embedded, and that ear was also a bit painful, so we had to err with a bit of caution there, but we managed to clear it. So there's just some dead skin at the second bend to the right, so that's the second bend just here. So we're just going to mop away any loose debris. Now, the aim of earwax removal, we're not washing a car or washing dishes or running the laundry. Wax is a healthy substance in the ear. We all produce it, and to different various amounts and different consistencies, of course. But earwax is mildly acidic, and the acidity helps to inhibit the colonization and overgrowth of harmful bacteria. In addition, earwax is oily and lipid rich, so it's a natural moisturizer. So that's the patient's eardrum. So it helps to keep the epidermis layer of skin hydrated, prevents it from drying and cracking. And earwax is, of course, sticky. So any foreign particles, like pollen, dust, dirt, that enters the ear, or even bugs, it traps into the wax. So you think about the wax almost like a spider's web. It captures foreign invaders. And for the majority of people, about 90 to 92% of the population, again, there's differences culturally across the world, the wax naturally migrates out of the ear by itself. So we all want a bit of wax. It's just when it's blocked like this, obviously it's going to be symptomatic. Another benefit of wax, because of the acidity, it does try and repel away insects from entering the ear. So it's a natural insect repellent. So the reason why I'm talking about the benefits of wax, and sometimes you'll see some wax left behind. Some people see that, criticize that, but it shouldn't be a criticism. And when I train specialists in performing earwax removal, a lot of the trainees, they read the comments on my social media, and it kind of makes them reluctant to post videos themselves. And I'm like, just post it. Don't be afraid of what people say. You're the expert, and always work within your realms, not only of skill level, because that will develop over time, but also, most importantly, patient safety. The ear canal is really sensitive and delicate. I've had trauma to my ear canal before, so I'm speaking from past experience. So don't be swayed by some of the comments you may read. A bit of wax is good for us, guys. And I'm also saying that because in this left side, you'll see there's going to be some residual wax, but I wasn't going to, attempt to remove that because this ear was quite painful for the patient, and it was residual natural staining of wax. So it's not going to cause any symptoms. So this is the patient's left ear. I've removed the outer third and also the middle section. This is all now right up against the eardrum. So in the last 5 millimeters of the patient's ear canal. And it was extremely large. I could feel that, how embedded it was, how adhered it was to the eardrum. But this is again one of the benefits of the WAXscope. Now, I don't mean to speak ill of other visualization methods, but it's very difficult to remove this without the magnification provided by the WAXscope, because when you're working so deep and up against the canal wall, you need that magnification to give you precision. Now I can just see a little hole through the wax where the eardrum has revealed itself, and maybe you can see that too. It's probably about 4 o'clock on screen. I've just moved the speculus that's blocking the view. You can see a bit of a blue tinge there. So just by revealing that, the patient noticed an improvement in their symptoms. Now I suspect some of this wax has been pushed in, given how embedded it was. When you've got wax so compressed, it has to be pushed in. Analogy that I give is if you're on the beach and you've got a bucket of sand, and then you get the spade and you use the back of the spade to push that and compress that sand into the bucket. It had that similarity with this wax. So to the left, you can see that ear canal. That's the anterior canal wall, so the front part of the ear canal. So this is the patient's left ear. And the ear canal curves from right to left. And where it curves to the left, there's a recess there, right in front of the eardrum, called the anterior recess. So this is lodged in there. So we're just positioning the suction probe into that recess. And I'm just slowly bringing it away. I'm just trying to loosen it initially. So I've loosened this bit, we're going to come away. We can see the back portion of the ear canal now. So the posterior quadrant, as it's known. I'm just getting that in focus again. It's quite matted. You can see quite a few hairs there. And I did put some olive oil just to loosen the wax a little bit. And it's worked really, really well. And I thought that was all of it. But there's still some right up against the eardrum, not only in the anterior recess, but also at the bottom part of the ear canal. So we can see the top part of the hammer bone there. I think I'm using the 16 gauge suction probe now, which is smaller than the standard 14 gauge, but larger than the fine end that we use. So it's a midway. And it works really, really well for this. Now, I have got quite a bendy ear canal. So this is me looking straight. The speculum is straight into the patient's ear canal. And you would, if our ear canals are completely straight, the eardrum will be right in central view. But you can see the eardrum is veering off to the left, almost at 30 degree angle. And it's also slightly upwards. So I'm just getting into the inferior recess here. This was really embedded. So I'm just hovering, letting the suction probe do the job. And for me, being able to perform this procedure using the WAXscope, it kind of does mean a lot, because this is something that when I first started performing earwax removal, I was using head-worn loops, and there was just no way I'll be able to do procedures like this. Hence why I then developed the endoscope. And I've always said it, the endoscope for me, if you are able to use it, and it's a very difficult thing to use, and I kind of appreciate that more over the years after training other specialists, it just provides an unparalleled field of view. But an endoscope is difficult for people to use. So I wanted to develop something that was more user-friendly. Now, is the WAXscope the most user-friendly device? Probably not, but it's significantly more user-friendly than the endoscope. But once you've developed a technique for the WAXscope of how to hold it, how to hold the suction probe, how to insert, it is then very, very user-friendly, but it does require training. And we do get a lot of inquiries from people who are proficient with a microscope or endoscope even, or head loops, just wanting to buy the WAXscope. And for me personally, that would be a great thing, because I can just sell it off the shelf to suitably qualified professionals without doing the training. So, and obviously it'll be cheaper, but it does require some training. Now that training, my training has evolved as well. I've been doing this with the WAXscope for best part of more than a year now. There may be other ways of providing some training, but there is definitely training necessary. So you can see there's a bit of staining around there, but we're going to leave that. Just some embedded residual wax. The eardrum's fully visible. Again, the patient's ear was painful before they came, because I suspect they did use a cotton bud. Well, I hope you enjoyed that video, guys. Take care, keep well, speak soon. Bye.